Bismillah, alhamdulillah, wassalatu wassalamu ala Rasulullah. Today's topic is eczema, and eczema is very common in children and even in the adults, but more common in the children. And what is eczema? So eczema is the damages and inflammation on the skin, which happens due to certain allergens attacking the cells in the subcutaneous region, cells like eosinophils or basophils. So these allergic cells, they release their secretions like leukotrienes and histamine and other chemicals, and that caused local reaction, which ends up into eczema. The next question is that what is the predisposition of the people who have uh, eczema versus those who don't have? So there is a great genetic problem, like people who have allergies, their relatives and the related people usually have more chances of having eczema. Like it runs in the family same way as the asthma runs, because asthma is also an allergic reaction. And there are many other kind of allergies like milk protein allergies and wheat allergies, which are present in these patients, and they are interrelated. So, which areas of body are involved in eczema in the babies or little ones, infants, is more common and is present around the head or scalp and on their faces, and even the flexor or extensor surfaces of the body. But the bigger kids and adults usually they have in their flexor surfaces, like in the elbow region, flexor surfaces and circles, and around the knee area and the flexor surfaces. So how we diagnose that is not anything else but asthma. So as I said, there's strong family history, and then you see the pattern of it, and then you try to find which area is located, and then you look at the lesions itself. They are usually like red and hypertrophied surfaces, and they're like scaly and they're cracking, which shows that there has been a lot of inflammation and accumulation. So, what are the damages which happen as a result of eczema? So, it's very itchy and it's very uncomfortable. Child is scratching all the time. It's miserable, and on top of that, you can have sometimes the bacterial superior infections and fungal infections, then can make it worse. And on top of that, if you have to use the treatment multiple times, what happens is that the skin goes atrophied or decreased thickness. So you can say that it changes the structure and color and pigmentation of the body. So next important question is that how we can treat these patients. So number one thing you have to do is try to avoid all the allergens possible which are causing this problem. That's the most important thing. What is the second most important thing is don't let eczema exaggerate. So how can you do that? So use the moisturizers. People use emollients, they use oils, but clinically the most important thing for this is Vaseline. So that is the most important chemical you need to put on the eczema area. It makes very good thickness, thickened film on the lesion, and it accumulate the humidity in that area, and it helps to heal the problem. So on top of that, you have to add sometimes the antibiotics locally because it's infected. Sometimes you may have to use antifungals to take care of it, and due to the itching and the pain process, you may have to give certain things systemically like analgesics and other chemicals. Most important thing is steroids. When it's exaggerated, it cannot be treated. It's like exacerbation of asthma. It's the same concept. There is the like healing is very difficult. Then we may have to go the steroids. So only moisturizer may not work. So we give the steroids. Sometimes you may have to give it systemically depending on the severity, and it can heal the area. But if you have to use those steroids time and again, then it may loosen or thinning of the skin as well as discoloration. What this is that the little babies, they have these lesions on their face and scalp. Now, face is a very sensitive area to steroids, so we don't want to put steroids on the face of the baby. It will change the color, it will change the texture and everything. So we have to be very, very careful. So what is the treatment in them? most of times try to use paraffin or Vaseline to use it continuously so that it doesn't happen. Try away from the allergens. But in case it's very severe, we have to go on steroids, and you can those use steroids like 1%, 2%. You don't go above 2% because the face area is very sensitive. We are very sensitive for like for skin is very sensitive. But for the face, it's for the same reason that it will hurt the face, so we don't want to hurt the face of the child. Prevention, so it's not that easy. We know that it's in family, so there's genetic predisposition for this. That factor we can't change, but we can try to find certain allergens which are causing this problem. Some people may have problem with the cold or hot. They can have problem with certain allergens and certain chemicals, so we have to try to find out so it doesn't happen. That's place. The second thing is use Vaseline most common than other emollients, and if there is attack happens, then treat it aggressively. And there is far more easy thing, not far more, but you can say the last thing we can think about is desensitization by giving different allergens. So it's a long route, and doctor really decide whether they have to go for the desensitivity of the skin. Thank you very much.